Hi, it's Susan Moore with Banner Health and Spirit of Women. We're getting to know the doctors here in Northern Colorado. I am delighted to get a little time with Dr. Regina Bower, and you work in Fort Collins, Loveland, and Greeley as a brain surgeon.
Correct, brain and spine.
This is a first for me. You're a neurologist.
Neurosurgeon.
Neurosurgeon, and that's different from a neurologist in that
we do surgery, whereas neurology takes care of brain and spine problems without the use of surgery.
Okay. Does that have anything to do with minimally invasive? We hear that term all the time. Or is that strictly for you?
So minimally invasive is a term that people are probably hearing a lot with regard to a lot of different types of surgery. And it's something that's becoming more prevalent in spine surgery as well, although not necessarily widely used yet. But myself and my two partners here, we do minimally invasive spine surgery. And what that basically means is it's a different approach to surgery than the traditional open approach that requires a very long incision, more injury or destruction to muscles. Minimally invasive approach allows smaller incisions and more direct approach that allows us to avoid so much tissue injury, and patients tend to do better with a smaller approach.
All right, here's my experience with back problems. My mother had back problems and she had a surgery, and I mean this would have been in the 1970s, and she was so miserable. What would be different today if she had a surgery?
Well, if we were to do a minimally invasive type of approach, it's less injury to muscles, so patients tend to have less problems with pain control after surgery, shorter hospitalizations, less blood loss during surgery, faster recovery overall.
Of course. So Dr. Bower, tell me a typical day, if there's such a thing, of a neurosurgeon.
So days typically would be split between either seeing patients in the clinic setting or doing surgery in the hospital, and we also manage our patients that are in the hospital as well, which would include patients that we're doing elective surgery on, or trauma patients that we see that have had injuries to the brain or spine. You know, as a neurosurgeon, we treat conditions that involve the brain and the spine, anywhere from trauma to tumors to degenerative problems or changes, particularly affecting the spine, and basically all of the above. Anything that affects those areas that would require surgery to manage would be in our practice.
And typically, who would you see as a patient? What symptoms would your patient have? Would it be extreme pain?
That's a lot of it. So for spine, that tends to be one of the biggest things that we see is pain either from arthritis in the spine or from nerve pinching, essentially. If a patient's had a herniated disc or bone spurs, slippage of the bones, that sort of thing, all those things can cause pinching of nerves, and that can result in things like pain in the arms or legs, numbness, tingling, even weakness.
Is this where minimally invasive surgery comes in to correct these?
Depending on what the procedure would be, absolutely. The most, I suppose, helpful, surgery that we would do minimally invasive spine surgery on would be fusions, which is among the biggest operations we do for spine, and tends to require very long incisions and a lot of tissue destruction and
a lot of recovery time.
Long recovery time, longer hospitalizations. So for fusions in particular, the minimally invasive approach has become really a tremendous improvement in the way that we do fusion surgery, because we're able to get patients back to their regular activities a lot faster than we had been able to in the past.
And are these often people that have injured their back doing an activity?
Typically, no. It more often would be from degenerative changes that occur as we get older. Can be repeated traumas, but also if someone has a family history of arthritis and they're prone to that sort of thing, we may see, breakdown of the elements of the spine faster, and that can cause nerve pinching and back pain and the sort of things that might, lead to an MRI that would show us something that we could fix with a fusion surgery with minimally invasive approach.
That's got to feel good to be able to fix that pain.
It does indeed.
Okay.
It does indeed.
And do you work as a team? Is there a whole group of you, or?
There are three neurosurgeons, myself and my two partners, Dr. Gibbons and Dr. Blatt, and we also have two physician assistants who are highly trained and very, very experienced in both brain and spine surgery and management, and they assist us in the operating room and also with taking care of the inpatients, and they also see patients in the clinic as well. And the five of us work together as a team.
And brain surgery, minimally invasive brain surgery, is that a new thing too?
At this point, not so much. There are certain techniques, let's say if you had a very complicated tumor in a very difficult to reach place, you may have a more minimally invasive type of surgery, if you will, which would be characterized as a different, under a different name. Mm-hmm. And that type of thing would typically be done by someone who's been fellowship trained to do a very specific type of surgery. So that would not be within our group. Brain surgery at this point is still done in the traditional way.
Okay. Dr. Bower, how does somebody know when it's time to come and see you?
That's a good question. So a lot of what we see in addition to brain is also spine, and people ask me a lot, when is the time for me to be seen by a neurosurgeon or a spine surgeon? Common spine problems would tend to be things like neck pain, back pain. If someone's just having neck or back pain, not necessarily the time to see a spine surgeon, as most of that is related to muscle pain and can be helped by conservative measures like physical therapy, that sort of thing that don't require surgery. Mm-hmm. However, if you're starting to have severe, pains going down the legs or numbness or tingling in the legs or arms, weakness that you notice in an extremity, leg, arm, difficulty with walking, things like that, or you're having back pain that seems to be getting worse and worse and is very difficult to control anymore with the ways that you've been able to manage it in the past, those may be times when it's time to go ahead and see a surgeon to take a look at everything and decide what are the options and do you need an operation.
Right, because you can have a backache from just pulling the muscle and
Correct.
Taking a non-steroidal anti-inflammatory, and no, that's probably not going to be a reason to go see you. But mm-hmm. The tingling down the legs, mm-hmm. you say. Mm-hmm. And could you repeat those again?
Sure. So pain that's going down the legs or down the arms, tingling or numbness down into the legs or arms, that can sometimes be related to pinching of nerves, and especially if we notice weakness, and especially if it's just in one side versus the other. Those things can all be due to pinching of a nerve somewhere up in the spine. Now they can be from other causes as well, but we think a little bit more about the spine to start with to make sure that there's not pinching of a nerve causing that.
And then what would the first step be? Would you do an MRI, or what kind of test would you do?
Sure, good question. So first step, we always tell patients when you start to notice things like this, your very first step is your primary care physician. And they see a lot of these things all the time, and so they can make the decision of, am I concerned enough that I think you need imaging? That may start with x-rays, perhaps MRI scan if we're concerned about nerve pinching. And then if there's something that looks concerning on the MRI scan, then the next step may be to refer you to see me.
Okay, very good. Dr. Regina Bower, thank you so much for taking time to chat with us today and let us get to know you a little bit. We appreciate that.
My pleasure.
Neurosurgeon. And I'm Susan Moore for Banner Health and Spirit of Women.